all, thank you for coming here today to this room in the European Health Forum in beautiful Bad Hofgastein, and to you online who are watching this, and hopefully you will be all interactive in this seminar. My name is Pernilla Gunther. I'm a former member of parliament in Sweden. I'm a patient advocate, and I would like to challenge you right away, the one who are listening right now. What would you do if you suddenly had such a severe disease that really make you wonder if there is any possibilities for me to have an organ transplantation? Maybe you never thought of this, but I will tell you, during this session, you will understand why you should really make a stand for being an organ donor and to really see the increased demand for equal opportunities for people to be transplanted in Europe. Since the end of the EU Action Plan on Organ Donation and Transplantation in 2015, in more than half of EU member states, the transplantation rates seem to have stagnated. There are also big differences across Europe, and I'm going to ask you now to participate in a little quiz that we have prepared to introduce you really to this topic. So those of you in the room, you can use your smartphone and enter the QR code, or by using the website slido.com and the hashtag Luna. And are you ready for the first question? What is the difference between the highest and lowest performing country in terms of numbers of organ transplantation by million population? Let's see what you think. Yeah, many of you thought, as it is, it's approximately 15 times more. And Spain is the country that has the highest rate of patients receiving a transplant per million population in Europe. From 2019 to 2020, it was 114.8 per 1 million inhabitants. And then the Bulgarian country has the lowest rate, 7.6 per million inhabitants. So let's move on to the second question then. How many transplant patients die in the first 5 years after transplantation? What do you think? Yeah. Hopefully they don't die at all, but we know there is suddenly it has appeared now on the screen that you think about 20%, but actually is a higher rate, it's about 30%. And the explanation is, of course, there are differences as regard organs, but for lung transplantations, there is an average of 30% of patients who do not live longer than 5 years after their transplantation. And my conclusion, in view of those statistics, there is work to do for all of us. We must create a level playing field for patients across Europe, and we need this level playing field to be higher than we currently have. So let me therefore lay out to you what ESOT, European Society of Organ Transplantation, wants to achieve in the next 90 minutes with your help and how we're going to go about it. So ESOT is in the process of drafting a European Manifesto to increase organ availability, promote equality in access, and not the least, improve quality and safety along the patient journey, including post-transplant care. And ESOT has already laid out current barriers as well as identified potential solutions. So what we would like you to do is in the 3 parallel breakout sessions, that second half of this session is really to discuss who needs to do what at which level. in order to implement these solutions across the European Union. You know, positive actions must not only be taken at EU level, but initiatives must be in place at national, regional, and local level. Only in this way can a true European health union for organ transplant patients be achieved. And this is really why we need all of you today. You might not be experts in transplantation, very few are, but you work in healthcare and interested in public health and can give your very distinctive perspective. And in this way, the final ESOT Manifesto will profit from your insights and expertise. But before you go to work, because we have all some work to do here today, before that, we will have the benefit of hearing from our expert panel. And let me introduce you to Dr. ALICIA PÉREZ BLANCO, bioethicist and specialist in intensive care medicine for the National Transplant Organization in Spain. You know, the country that have the highest rates of transplantation. And online, we will have the honor of having Dr. BUŞOI, member of the European Parliament, an expert on health and research policy. And on stage, we will also have HELENE VIATGE, Chief Operating Officer of Cibiltech, a company whose mission is, and I quote, to improve patients' lives and health system by postponing organ failure through the power of artificial intelligence. And the last, not the least, Dr. GABRIEL ONISCU, consultant transplant surgeon at Royal Infirmary of Edinburgh, and he is also the president-elect of ESOT. Very welcome, and thank you for being with us today. And let me start straight away into our 30-minute discussion by asking ALICIA, tell us more about why this transplantation rate in Spain is so much higher than everyone else. What is really Spain doing differently to achieve this?
Hello. Very nice, and it's an honor and a pleasure to be here. Thanks for introducing me. I will try to briefly explain the three pillars of the Spanish system. And the first is disease donation. We emphasize this program because we as a society believe that in the benefits of organ donation and in the public health universal care system, not only for the public, not only for our neighbor in need or our daughter in need, but also as for ourselves to leave a legacy of life to any other. This is part of our culture. But not only comes from, let's say, an inherited solidarity or a culture or an education. It's part of a training that the ONT has been investing in the healthcare professionals. So nowadays, and since the creation of ONT, we invest in training, so any routine conversations about end of life with any patient themselves or with their relative or with their parents pose the possibility of organ donation. That's a routine approach. But only in the case that the person had expressed denial to organ donation or are not inclined to keep on with this conversation, we always give the opportunity to receive information about organ donation. This inclination to donate or to be positively seeing organ donation wouldn't fruitfully end up in transplant rates if we didn't have worked hard in a solid organization and a solid framework. So ONT has organized or is is organizing and working through the whole process of donation, from the very beginning in the hospital, donating hospital, to the transplant hospital. And the main character of this organization is the donor coordinator. Donor coordinator in the donation center is in charge of identifying every possible donor, so you do not lose any opportunity. Take into account that only 1 to 2% of persons who dies in hospital do that in conditions that may evolve to brain death. So if we are not very carefully following up all these possibilities, we will lose the opportunity for organ donation. So we have invested a lot in training. That's another very special peculiarity of our system. We train every single year all intensivists. So the Intensivist Society and the Anesthesiology Society embrace donation as part of the best practice, the medical practice. So they know how to do the correct maintenance of the organ donor. They know how to do the diagnosis of brain death, and they are going to refer any patient that in whom withdrawal of life-supporting measure has already been agreed upon with their family and with the responsible physicians. They are going to notify this case to the donor coordinator, so they can have an approach, has an interview with the relatives.
Okay, yeah. And because I wanted to follow up that with Gabi, who have been working both in the eastern and western part of Europe. What is your experience from this? Because ALICIA is talking about training the healthcare professionals and to make it possible really to be positive also from that side. So what's your experience?
Thank you, Penilla. It's great to be here. And it's just before I answer that question, it took Gastein 25 years to recognize the importance of transplantation. So we're delighted to be here in the 25th anniversary to discuss a very important issue for healthcare in Europe. So I'll come back to that point. So the Spanish model has been implemented in other countries and quite successfully, I might say. So beyond the structure, beyond the infrastructure and the policy, I think it's the education and training of the staff, but also the education of the public. Because one of the things that happens in Spain, there's a significant migration, particularly from Eastern Europe, but even the migration population donates. So they've adopted the culture of the new home country. So I think there's a very key element here in promoting donation across Europe and recognizing the benefits of transplantation through a sustained campaign, but also through a positive media image, which doesn't always happen in all European countries.
So, Dr. BUŞOI, who are working at the European level, indeed, what can be done then at the European level? Do you think, listening to these doctors who are very, hands-on this topic?
Thank you so much. Yes, at the European level, there are several initiatives that could be useful in order to increase the access of patients to organ donation, to increase the number of donators, and also to improve the post-transplant care, extremely important also. I believe that we need to make sure that organs donated do reach the patient in need, and this is not the situation everywhere. There are big differences. You just mentioned Spain as a success story. Of course, it's a difference between Central and East Europe countries and the Western countries. And of course, we need to make sure that they do not get wasted through bad treatment and care. I'm the rapporteur of the European Parliament for EU for Health program. This is the health program of European Union, 6 billion euros in 7 years. And here, of course, what is important is that we should work together in order to make sure that in the future will be calls for proposals to improve data generation at national level, including data related to organ donation. I know the initiative of ESOT, and I totally support the idea to build registries on transplant is extremely important, also interconnected between different European countries. And of course, these registries, patient registries on transplant could be very useful only if good data is available throughout the EU. So, European Union could help in three ways: through concrete sharing of good practice and discussions among member states, how to implement this throughout the European Union. And here, European Commission is organizing different initiatives in order to bring together the best specialists and to learn from each other. Of course, then we have the legislation. You know that health policies are a matter of national subsidiarity. National governments are taking the most important decisions, but we have also European decision. So one example could be this European health data space. There could be a good opportunity also for sharing the best data and building the base data on transplant at the EU level. And of course, finally, through the provision of funding for data generation. I mentioned the EU for Health program. I'm also the chairman of Industry and Research Committee in European Parliament. And you know that we have the Horizon Europe program, 95 billion in total, more than 7 billion for health actions. Clearly, the focus is on cancer. Also, diabetes and cardiovascular diseases are also very much high as priorities at the policy level. But clearly, we need to discuss more and more about organ transplantation, and it is important to make sure that organ transplantation will be included among priorities. And as it was mentioned before, that it took some years for Gastein Forum to put transplant as an important topic. I believe it is the moment now also to see transplant as a health priority at the European Union institutions level.
Thank you so much, and it suits well to go on to HELENE and talk about health data, and I think there are some investigations that really makes it sure that patients would like to share their data, and how can we approach that in this topic about transplantation?
Yes, thanks for the invitation to speak today. But I think we can actually speak about how data can improve transplant care, but also how transplant care can improve and help the European Union to tackle the data issue in healthcare. Because you have to acknowledge that transplanted patients are actually 10 times more likely to develop chronic diseases like diabetes and heart conditions. And they are also captive patients, meaning that they come back to the hospitals where they were transplanted for years and years. And so you have a unique opportunity with transplanted patients to actually gather data and learn a lot about also chronic diseases and not only transplantation. So I think it's really a win-win situation where transplant patient can help us to learn how to leverage data to its top of its ability, and data can help transplant care. And I think transplant care can be improved by data through at least 3 ways. The first one is data can be used to improve organ availability by better identification of donors and by better matching between donors and recipients. Data can also help to improve transplanted patients monitoring and donors post-transplant monitoring. And by this, if you improve the monitoring of transplanted patients, you can improve the graft survival and the quality of life of transplanted patients. And last but not least, data can help the development of needed new therapeutic options for transplanted patients by better trial design, patient recruitment, clinical studies, delivery, and also by using digital biomarkers. So yes, I think data can dramatically improve transplant care.
And that will really make me ask Gabi, because I think there is sometimes a misunderstanding that transplantation is really, something so special that it's not needed to have any any knowledge about it. But actually, it affects people who are having bad heart conditions, kidney, liver, and a lot of conditions that really make you think that, okay, this is the last or the end of my life, but I really need to have this transplantation. So why do you think then the differences between countries and what the possibilities are to really make a more equal healthcare within transplantation? So we can really send a strong message to our member of parliament here.
That's a very, very complex question with many sub-questions in there, Penilla. And I think it's important to hear that cardiovascular and cancer are many issues at the heart of the new policies, but actually they exist in patients who need transplant. And unlike many other treatments that we provide there, transplant restores not only the quality of life, but extends the quality of life, and it's economically beneficial to the society. So everything else we discussed at this forum, the cancer, the other treatments, this is what sets transplantation aside. Now, of course, there are many variations, and the roadmap that was published with ECHA and we contributed to it clearly shows that there's differences in Europe. So I think some of the way to level those differences, as you say, start very much at the political level. There has to be, at the European level, a political drive and will to implement broad policies, then they can be taken to individual country level and expanded and adapted to the cultural sensitivities and local situation. That has to then be followed by infrastructure. Infrastructure needs to be developed and implemented. And I think with infrastructure comes how we work, because we talk about guidelines later on, and they need to be adaptable. The next step would be education and training, and that is on twofold. It's not just professionals to understand what is the best practice, but also patients. And we need to work in partnership with patients and empower them. It's something that is a recurrent theme at this conference, time and time again, is patient is in charge of their care. And if we have that, then we are in an ability that patients can challenge the healthcare professionals to provide the best care, and why not if that's not? We talk about data benchmarking. I would add one more thing in there about what's been said. It's actually benchmarking. What allows us to understand is what is the variation in practice from one center to another. And that's not to have a punitive approach, but actually to have an informative approach. How can you get the best outcome for your patients in that clear setting? And I think the key, as I said, is actually restoring trust into the system and getting patients to drive the innovation and change and be at the forefront of all the developments, because then things will happen.
Thank you. And Alicia, when you listen to this, what do you see as the obstacles you can discover from other countries? Because since you are successful in Spain, what are the obstacles for others?
Well, I agree with my colleague that if it's not in the if donation and transplantation are not in the political agenda of any government, you don't have anything to do. In Spain, it's always a priority of the public health system. If you do not invest in training, that's the other pillar. We invest, the Spanish government invests every single year more than 1 million euros in the training of not only healthcare professionals, but in other professionals directly or indirectly related to donation. Another very important pillar for me is regulation and legal framework. If you do not have a legal framework enacted, basically, if you've got an enacted legal framework, it's wonderful, but if not, at least regulate it and specifically address the issues of brain death diagnosis, diagnosis of circulatory by death, and then healthcare professionals are not going to be able to do any transplant. And last but not least, I would say the trust in the system and makes the healthcare professional, the specialist, to enlist patients because they know that they are going to get a transplant. So what happened in Spain is that public trust the ONT and the public healthcare system. So you are always positively inclined to say yes. Healthcare professionals are prone to indicate transplant as the final and definitely treatment for organ failure because they know that their patients are going to get the transplant.
Then I will thank you, Alicia, and I will pass on that question or some of what Alicia was pointing out to Dr. BUŞOI. Confidence, having confidence for the public healthcare system in Europe is really a major thing for the population and to be organ donors, maybe. So do you think that is something also to really work on for the European Union? I mean, to have confidence in treatment and equality is something very important. What are your reflections?
I believe that clearly, and I agree with Dr. ONISCU, if we send a strong message from European institutions that we need to have transplant as a priority in the national policies, clearly this could be helpful and put some pressure on some governments who are not as ambitious and as successful as Spain, for instance, and not only Spain, of course, to do something very concretely. My country, Romania, took some steps. There are some good achievements, but still we are far away from what could be a decent situation for transplantation. And clearly, the trust of citizens in the health system is crucial because, first of all, they should be assured that their organs are not wasted, are used in the best way possible, and could be also a psychological issue. I think the fine experts, the extraordinary experts that you gather today have a better image than myself. But we cannot build trust from European level because European institutions, we should admit and we should be sincere that their actions are limited. Clearly, this should be the duty of the national governments or regional governments in some countries where the regional authorities have prerogatives in the healthcare. But the EU level, putting pressure on national governments, sharing the best practices, and putting transplant as a priority to be included in the national programs could help to improve the situation. The inequalities will remain because the possibilities are different. The countries that are advanced now will continue to invest more, to build more on what they already achieved. But this is not the idea to bring equality. It will be not easy, but to reduce inequalities. And in those countries, especially Central and East and South of Europe, where clearly the situation is not very good, to see real progresses. And the European institutions and those countries that were successful until now could help a lot.
Thank you so much. And the final question to HELENE, and I maybe I put the words in your mouth, but data, and according to what we heard before, by implementing registration for organ donors and other, of course, health statistics and so on, is that a possible way for those who are, you know, at the lowest level right now to at least improve the number of transplantations and the possibilities really to build something for the future?
Yes, I think it is. But I think the possibility will come from digitalization of the healthcare system, really. despite the fact that the EHDS, the European Health Data Space, is a great moonshot to reach for acceleration of research around transplantation, I think the first step is to build the rocket, and so to build really the digital healthcare system that is lacking today. And so, yes, obviously, countries who have low level of transplantation will benefit from a digitalized system, because as soon as you have structured data, accessible data, then you can identify way more easily available donors and much better the donors and recipients and improve transplant care. But for that, you need a system in place that allows for patients' communication, primary care and secondary care communication. And data today is spread along those three pillars, so patients, primary care and secondary care, with very limited communication and exchange of data. And that's common all over Europe. Spain is a bit better, and we've discussed it, but Germany, France, lots of countries are actually very late in terms of digitalization of healthcare system, and that's a huge barrier to improve or increase access to transplantation, I think.
Thank you so much. And now I'm putting you all into work, hopefully. And I will, of course, say thank you so much to Dr. BUŞOI, who joined us online, and to all of you here in the room and online. Don't forget to be part of this. I will ask you to join some tables here in the room. And we will have some parallel breakout sessions. We will have some discussions within 3 different teams. And the first theme is approaches to increase organ availability. And that's online. We are different Zoom link. And we have 2 people who will help out with that. And we will have 2 sessions here in the room. And since we're having more people on this side and not so many on that side, maybe we could share each other tables and make it more equal, maybe. We try equality here. So we will have a discussion really to review the identified solutions from the ESOT draft manifesto and to discuss the classical questions. Who? Is there EU policymakers, national authorities, transplant centers, patient groups, sick fund, data experts, and so on? Who needs to do what? At, of course, which level are we talking about? Is it the EU, national, or individual, doctor-patient relation, or which level are we really think that could do the best or be the best benefit for people? And also to implement the solutions identified in the ESOT draft manifesto. And furthermore, the breakouts should also discuss whether there are other solutions. Maybe you find out something new and very innovative, you never know. We have some grid to really show what kind of ideas you can print in these grids. And this is really meant to be an inspiration also and to increase knowledge. So it will really be good to hear about your group, what your groups are thinking afterwards. And we really would like this to be a start to think a union for transplant patients. So if we have these groups, and we will have also some rapporteurs, of course, from these groups. If we divided this room into at least 2 groups, we will have 2 rapporteurs and 1 from the online group. So are you ready to work? Yeah, good. Thank you so far, the speakers on the stage. And I think that we can start right away. And please, you are on, who are online, you will have some guidance, of course. I would like to start with another question, a much more easier question than I think you have been discussing. Do you like birthday cakes? No one? It's incredible. Birthday cakes, you like birthday cakes, yeah? You know, I get 2 each year. I have 2 birthdays. One, August 13, and the second one, April the 1st. And it's not because the Fool's Day. Well, actually, I had 2 birthdays because I had a heart transplant 15 years ago. So what you were really doing right now in these discussions, it was actually a work for life and death. People are depending on you here. Your good ideas and your good work can really make people, you know, really increase their time of life and have a new life. Parents will get their children back. Children will get their parents back. And, you know, to be aware of that, to be a part of that, I'm a very lucky woman. I'm a very lucky grandmother. I never thought I should be able to see my grandchildren, and actually I am, and so happy about that. So what you're doing, everyone, is really to increase knowledge about the importance of life and how beautiful it really can be. So thank you all for joining these discussions. And now I'm so curious about your ideas and thoughts about this. I guess you have some rapporteurs from the groups. Where should we start? Anyone voluntary? Yeah? Gabi is eager to get started.
I'll have a go at it. So really, we looked at equity of access, and we had a diverse group in various areas, including a journalist, which is great because it's important to have that in here. We realized pretty quickly that we have a number of challenges. So European level translation to the local level is a Herculean task. Because very few things can be easily translated. But and time was very short to discuss 5 or 6 topics that we had here. But essentially, what we've identified that what can be done at European level, and that follows nicely what Dr. BUŞOI was saying, is I think we can advise about health literacy, but health literacy is a very local issue that has to be translated nationally and locally. But that can be done because it is one of the key factors for variation in healthcare and particularly in access to transplant. But then because of the peculiarity of the transplant process, which is including identification of patients who need a transplant, workup, listing, and then transplantation, which is a completely separate thing, we identify that perhaps at a European level what it can provide, we can come up with a set of principles that would identify who should be listed no matter where they reside in Europe. And of course, then that needs to be translated further on a European level, adjusting the principles, and then moving to the local level. And Helen was telling us about the French system, where actually there's an incentivization to talk and promote transplantation. And I think we need to come up with that idea of transplantation first. Also at European level, we can talk about exchange schemes for patients who are disadvantaged, very difficult to match, and so on. And there is a need perhaps for a European transplant reference network, which then feeds into the national and local policies where people have difficult cases and can discuss. We opened the can of worms talking about the data sharing legislation, and we very rapidly identified that doctors are not ITists, so we need to get the right group of people trained. And then, of course, at national level, this is where we need to have supportive legislation to empower both patients and professionals at the local level and adjust the principles. And there's very clear there needs to be national responsibility and accountability for funding and creating the infrastructure to allow those services to develop. And we need to have support, the right care of support. And ultimately, it comes down to the shop floor. We recognize that the elephant in the room, people do not listen to Europe. They will do whatever they want because they think they know best. So I think it's a change of culture, mentality, and so on. In terms of promoting donation, leveraging other healthcare professionals who may contribute to this, not necessarily directly involved in transplantation. So I think it's a lot of work to do. We've only scratched the surface in about 5-10 minutes, but it's quite clear that the task ahead of us in each of our respective countries is big and requires a very concerted effort from everyone involved, from European Parliament down to the practitioners and the patients.
So maybe we should do these discussions in every country then. We could travel around and have some workshops.
I think you can do the workshops, but I think unless you have the guiding principles set up and the level of support at the European level and then education at on the shop floor, we cannot move. I think that's very key. It has to happen at local level. And I think it's empowering the patients to take control and ownership of their management, because someone said earlier on, it's about self-management. It's not about how long they spend with us. 5-10 minutes, in consultations it's very short. But then it's empowering them to drive the change, to challenge the principles and say, why not, based on the guidelines, why not the best care?
Thank you so much. And I leave the floor to ALICIA, who was leading the other group. It's on.
We discuss basically one point and extended it, which can be summed up with the training. And we wanted to emphasize that, for example, for a Romanian surgeon that wants to do any kidney transplant, they are in need of being trained by another surgeon. And perhaps at the European, the national level could be selecting those highly selected healthcare professionals in the medical field and in the surgical field that may go abroad to learn the practice. And this European level will be that the European Council of Europe or an action plan will give the structure, the infrastructure for these professionals to go abroad and learn in, let's say, let's do a list of university transplant centers that could receive physicians from abroad, and let's say they could stay with them doing a fellowship, and they get back home and do practice at least the basic first steps. So national level must be the compromise and to found this, and the European level will be that you are going to bring them the knowledge and so on. There is also a guidelines, because there is a guideline here word that is already published every year. The Council of Europe, and some of them will be familiar with the guide of quality and safety of organs and tissues and cells for transplantation. And it is already it is in the website for everyone. So perhaps ESOT and the scientific society could circulate this and emphasize that this could be the basis knowledge for anyone who is in the transplant field. So we've got the guidelines, and we perhaps just have to circulate them, or to make them in a more aware make the healthcare professionals in the field more aware that they exist, and just count it in the curriculum of anyone that wants to become a transplant professional. And we also said that the follow-up of the transplant patients must be a responsibility of the European level, because you can travel easily cross-border, and perhaps you are a Spaniard or traveling into Austria, and you suddenly had a heart attack while you were skiing, and you go to any hospital, and your data must be there, and they can have a look at your charts and know about your transplant, your immunosuppressant medication, and all this means that there must be medical specialists all over Europe that once have the data about the patient, and two, the knowledge to make decisions about their situation. So that's what I don't know if I left something behind, but
I think we will have, thank you, Alicia. We will have the last session group also to present your point of views. Please. We have a chair for you.
Hi, everyone. So in the online breakout group, we discussed actions to increase organ availability. And 4 main points came out of the discussion. The first was the importance of going for generalized opt-out systems to increase organ donation, but the importance of having a true opt-out for those who have some personal or ethical issue in this regard. Secondly, having public education campaigns to increase the awareness of the public about this issue and increase understanding, even though these can be very sensitive and delicate topics because it has to do with end of life. We felt the need that we have to broach that subject, we have to go there to address this, but obviously in a culturally sensitive way. Additionally, the importance of cross-border collaboration and cooperation to increase organ availability even in certain challenging scenarios like small states. And lastly, something that might be considered more in the future, the possibility of xenotransplantation, keeping in mind the scientific and the ethical challenges and difficulties that would bring with it. So that's our feedback.
Thank you so much. And I think the last thing we heard from the online session about xenotransplantation, everyone have heard about the heart transplant from the pig that was made in the US in the beginning of this year. So I guess the question or the areas of xenotransplants has really been raised again because of that transplantation. So it's really something to be followed up. Thank you so much for taking care of these sessions, and thank you to all of you who have been part of that. And I would like to have some short reflections from the experts here. Helene, you were not the rapporteur, so you have maybe a few more words to express in your reflection. What has you been taking with you now from these discussions, or what you have heard?
Yeah, I think as we discussed in the groups, it's all about European level, national level, and local level, and we should not forget the local level. And I think that data and digital, so not only data, but digital solutions can actually help to compensate for the low levels of the low number of healthcare resources and other IT resources. But we do need to make significant investment, and in Europe, and I'm really hoping that the European Union is going to make this investment, we need to target financial European support towards national digitalization of healthcare system, but also towards more health education. And to do more health education around transplantation will really be done through all the levels, from local to national to European and global level. So the WHO obviously is also part of this, of the story about health education. But I think we really have still a huge, significant roads to improve the number of transplanted patients in Europe. Xenotransplantation is really fascinating, but we still have lots of we can improve the number of transplantation just by having more data, more education. I think Alexandre Lupi in the past published a paper saying that in the US, half, I think, of the discarded kidney could be actually transplanted if they were to use the same rules than what we've done in Europe. And so, and you've mentioned as well the fact that if we educate people to say you are actually going to need a transplant soon, people can actively start looking for living donors. So there are lots of ways to improve the organ availability and access to transplantation. And I am quite optimistic that we won't need that many pigs so soon.
Thank you so much. And ALICIA and Gabi, some short reflections. What are you bringing home?
Well, I think that we need to share much more between cross-border and cooperate. There is a lot of platforms right now. We share organs, we share knowledge, we share data, registries, but we think that we should do all this in an organized way, because perhaps we are doing it in separate efforts and we are not getting the results that we should. Perhaps we can, the European level could do this organized step-by-step cooperation and share.
Thank you. And Gabi?
Notwithstanding what everyone else has said, I think in my view we need two essential ingredients. First of all, it needs to be a unified political will. If organ donation and transplantation are not on the agenda, that's never going to happen, and that's needed to improve the legal and infrastructural framework, institutional framework, and provide funding, ultimately. Secondly, the important ingredient is the societal trust in the system. I think that needs to be restored, and we heard time and time again through this conference that needs to be happening. And then we need to move to a new principle, which is shared decision-making and self-management for the patients. So if I were to sum up the solution, there's 5 words I'm coming up with. Engagement, empowerment, challenge, change, and connect. And what I mean by this, I think we need to engage political institution, public, and patients to actually develop the transplant policy at a local level, national level, reflected and supported at the European level. Secondly, we need to empower patients and professionals to actually drive those changes at local level, because ultimately that's where things happen. Probably at national and international level, European level, we need to challenge the current practice and dogma, because we need to move towards best care, best shared practice, and guidelines. And doing so, we will change behavior, we will change practice and knowledge and perception. We need to, that'll be a cultural change both in the patient group and also the healthcare professionals. And it's part of education and data. It's exactly what Helen was saying. And ultimately, we need to connect. It's what ALICIA was referring to. We need to connect. We come out of the silos and do that together. And create that professional network and supported by research that allows us to push those developments and not have a postcode lottery.
Thank you. And we have actually the ESOT president, Luciano Potena, here. Welcome. And share your reflections on what you've heard. And of course, I'm very curious to hear about the manifesto and when you are finalizing it and of course the launch of it.
Thank you, Penilla, and thank you, the Gastein Health Forum for allowing ESOT and Takeda to present, to have this session, and thanks to our speaker and to the attendees here and online. So, Penilla, you are right. We are going to launch our manifesto as the manifesto of the European Society for Organ Transplantation, and I would like to take as a major word to start my comment the last word that Gabi said, so connection. So why we are here and why it's important to be here. We are here because with ESOT we wanted to get out of our silos. Okay, our silos has been for many years the educational of healthcare professional, but to really improve the outcome of the patients and to really get the barrier for a better outcome in transplantation, we need to get out of our silos, to engage with stakeholders, to be accountable for our results and our education, and to engage with the public, with the policymakers, and with the other stakeholders. And this is why we are here, and also because we need the input and the collaboration of the stakeholders that are not necessarily involved in transplantation. And I learned something also in the breakout session that I was attending. We are, as healthcare professionals in transplantation, we are taking for granted a lot of issues that in the general public are not for granted, like what is around the end-of-life issues, what is around organ donation. And this is something that we have the responsibility to push and to advocate for. So with our manifesto, we are proposing solutions. Today, I think that we identified some of the solutions that can be pushed forward for the future. And these solutions are around the concept of data. The solutions are around the concept of education and advocating with the policymaker, and education at different levels. Patients are more and more important, as also has been said earlier. It's important to give appropriate health literacy to the patients, to give them more awareness and the power to decide and to drive their quality of care. So thank you.
Thank you. And my own thoughts about this also, as both a former policymaker and a patient advocate, is really to think that what I asked you from the beginning, have you ever thought of being, an organ donor? Because that is a question that we all really can consider. And if you are like me, I had a donor card in my wallet for years. And I never thought that I should, being in that situation, that I should really be needing anything. But I was thinking, if anyone could have use for me, that would be good. So to really have also that approach as an ordinary citizen, and to be able also to promote during the European Donor Week, I think that is something we all can do. And I have a short story that someone told me. They were out, sharing these donor cards, and then a lady came across this group, and she said, "I would like a whole box of donor cards." And they said, "Why? I mean, isn't it enough to have, just a few, maybe 3 or something like that?" And she said, "No, I need a whole box because I have all my relatives coming to dinner tomorrow, and suddenly we have something important to talk about." So hopefully you have something important to talk about after this session. And thank you for joining. Thank you for joining us online. And take good care of you. And see you.